Hi there, so we're here with Amber today, and Amber has come in for Botox, but we're going to convert her. So let me tell you what that means. There is another product called Dysport, which works like Botox, but the studies have shown that it lasts 20 days longer on average than Botox does. So it's kind of a sister or cousin of Botox. It's the same price though, so why not get more for your buck? So Amber, which areas were you looking into treating?
Well, I was really concerned about my forehead lines and my frown lines and also my crow's feet.
Crow's feet, okay. Do you find that when you wake up in the morning, these lines are more prominent?
Sometimes.
Sometimes in our sleep, we make angry faces, which I can clearly not make right now for obvious reasons. And so when you wake up, a lot of people will say that these lines are more prominent. So the use of Botox or Dysport in this case is to relax the muscles. We're not changing anything about the volume of the area, we're just telling the muscles to kind of calm down. So on average, Dysport will last between 3 to 4 months. I want to point out a few things. When we treat this muscle, get angry for us, Amber, this muscle, it provides a slight, relax for a moment, raise to the medial brow here. By treating the crow's feet here, we relax the muscles of squinting. And squint for us? Great. So it'll stop us from doing that, and it'll also elevate the lateral brow by 1 millimeter or 2. So Amber, any chance that you could be pregnant or breastfeeding?
No, not whatsoever.
Any history of neuromuscular conditions?
Nope.
Okay, just a few things to let you know after we clean you off and we take care of the injections today. We don't want you to lie down for 3 hours or work out for 6 hours. Is that going to be okay?
Perfectly fine.
Okay, let's get started.
Thank you.
So a lot of patients will say to me like, oh, I don't know if I want to do Botox. I don't want to look fake or frozen. What leads to people looking fake or frozen is actually putting too much product. So with Botox or Dysport, once you put the product in, you really can't take it out. It's there. So by putting a small amount and kind of seeing how you respond, basically less is more. So we can achieve a more natural result by putting less product and see how your muscles react. All right, so let's get started. And why don't we begin around your eyes? This is one of my favorite areas to do because you can really prevent those prominent lines around the eyes by treating preventively. Okay, I'm going to have you rest your head back. All right, and I'm going to have you squint. All right, okay, and then just relax for me, Amber. All right, I'm going to lean here on your ear, and 1, 2, and 3. How are you doing?
Good. I don't feel anything.
So in our facility, we use really the smallest needle that we have available in the field these days, a 32 gauge needle. And by using the small needle, we both make your experience a little bit easier, and we have a less chance of hitting any blood vessels to cause any bruising. So we are now done with this side, and we'll move to the other side. How's that?
Good.
Okay, great. Squint for me again. There you go. Okay, just relax. So when I'm pinching you here, I'm doing that for 2 reasons. 1 is because it kind of distracts you. 2 is I want to inject the very superficial part of the muscle that's called the orbicularis oculi, and also to lift the skin off of any blood vessels that are underneath. Again, to reduce any risk of bruising for you so that you can be in and out with this treatment. All right, you are great. Any discomfort?
Not at all.
Okay, let's do this area, the glabella. And again, this is the area that when we treat it, it will elevate the brow just a little bit. So I'm going to have you turn towards me. All right, and I'm just going to pinch here. I'm going to put my right pinky on your left cheek. Here we are, 1, 2, and 3. Very good. You're a superstar. Any discomfort?
Not at all.
Okay, I'm going to have you get mad. Try to, so you can see the muscle here that's pulling from here. So I will grab this here and a little poke here. Good. And again, get mad. Very good. All right. And as we treat the forehead, I will have you actually raise your brow and hold. And relax. Good. So another way of achieving a very natural result is to disperse the material. Of course, we want to minimize the number of pokes for amber here, but by distributing the product evenly, we can make a more flowy result. We're almost done here, okay?
Mm-hmm.
All done. So let me clean you off. You did very well. There's no evidence of bruising here. And as I said before, you don't want to lie down for 3 hours. Don't work out for 6. You will begin to notice the difference in about 2 to 3 days. Another advantage of Dysport is that it starts working 1 day earlier than Botox does. The little blebs that you see right now will go away in about 10 to 15 minutes. All right? How was that?
Good.
All right, Amber, you
Thank
did great.
you.
Thanks for joining us.